breast health. I'm Jennifer Mead, Hologic's Division President for Breast and Skeletal Health Solutions, and it's my absolute pleasure to be here with you today for this critical dialogue on breast cancer screening and the inherent racial disparities facing Black women across the nation as it relates to annual mammograms. October is Breast Cancer Awareness Month. I hope you all know that by now. This is an incredibly important time of year for our organization at Hologic, as we are focused on women's health and well-being through early detection and treatment. At Hologic, we are driven by a single purpose, a common passion, and a lifelong promise to help all women live healthier lives. A great example of that mission in action is a project that we just launched about 2 weeks ago, the Hologic Global Women's Health Index. This index is the world's most comprehensive and globally comparable survey, getting insights directly from women and girls around the world to measure the state of health globally. Women's health is the cornerstone of families, of communities, of societies, economies. Yet, until now, there was not a single measure where we could assess and compare by country and by territory the state of women's health. As a leader in early detection, diagnosis, and treatment of some of the most common women's health issues, Hologic is acutely aware of the importance of measurement and unbiased data in driving improvement. And so we saw a true need to set up a structure and gather this data so that we could influence policy and we could start the dialogue for women around the world. Now, while we initiated the Global Women's Health Index prior to COVID-19 impacting the world, it is absolutely becoming more urgent when we see the impact of the pandemic on all aspects of our lives. We've seen canceled or postponed preventive care, We've seen an increase in poverty, increases in unemployment, lack of access to healthcare facilities and providers, and we've certainly seen an increase in the disparities that have faced women of color for years. And so, I think that the results that we've seen from that have certainly created more urgency, and we need to see global leaders and policymakers step up, take action, and prioritize the health of women. Now, the results of the first survey are in, and I'll be very blunt to say that they are alarming. If you look at some of the most common healthcare issues that women face, the data from the Global Women's Health Index showed that there are 1.5 billion women around the world who in the past 12 months have not been screened for some of these healthcare issues: cancer, diabetes, high blood pressure, sexually transmitted diseases and infections. And sadly, cancer killed nearly 10 million people around the globe last year, and only 12% of women reported being screened for cancer in the prior 12 months. We have got to do better for women around the world. The data points to what I'll call a second pandemic, right? So we're going to see increases in early detectable and preventable illnesses like cancer, like diabetes, like heart disease, because of the cancellation or postponement of preventive care. It is well known that early detection saves lives, and that preventable or early diagnosis will help the outcomes of women across the world. With record numbers of missed appointments, coupled with what was already a significant deficit globally in the status of women's health, we are going to see increases in death and well-being, and we are going to continue to see a decline in half of the world's population health. At Hologic, we have a long-standing commitment to the belief that women deserve equal access to resources that will allow them to take care of their health. These issues have certainly been exacerbated by the pandemic, but they existed long before 2020. And that brings us to why we are here today. Our belief inspired us to launch Project Health Equality earlier this year, a multi-year, multi-pronged commitment to decreasing health disparities for women of color through research, education, and increased access to care. Since then, we have been proud to partner with the Black Women's Health Imperative and Rad Aid International to spearhead important research, launch several education and awareness campaigns, and most importantly, deliver resources and technology so that women across the country have access to the care that they need. You'll hear more about this during today's program as we work to uncover reasons behind these persistent disparities, and on a more positive note, and more importantly, some potential solutions going forward. With that, thank you again for being here. I will turn it over to our moderator, Sheinelle Jones, to introduce the panel.
Good morning. Wait, I feel like I was joking behind the scenes. Do you remember, I'm 43, so I don't know how old everybody is, but I just remember back in the day, you'd watch those commercials, like the 1-900 or 1-800, and it would be like the Time Life lady. Do you know what I'm talking about with this? I feel like that. Anyway, good afternoon, good morning. Thank you guys for coming. I am so excited about the conversation that we're about to have. I was just reading the bios of our panelists. They're rock stars. They're a who's who. I'm just curious, how many of you either know someone who has had breast cancer, have someone in your family who has had breast cancer, or you just know anyone in your life who has been affected by breast cancer? That's everyone. And I think every year, you know, we talk about breast cancer awareness. On the Today Show, we do pink power. We wear our pink blazers. We put on our pins. But I think sometimes it is so important to just push the pause button for a moment and remember the faces of the women who have been affected. I have a dear family member who is going through a battle right now. And I remember, gosh, 2 decades ago, my piano teacher, back when they didn't really know as much. And so I think about how far we've come in those 20 years or so. And then, Lord willing, you know, in years to come, this won't even be a thing. We'll know right how to do it. So I'm hoping that today, even though you guys are the experts and you know everything, that maybe something one of our experts says or does will leave you feeling uplifted, motivated. Maybe you learn a little something that you didn't walk in with. So that's my hope. So with that said, let's jump into our panelists. I'll introduce them. Our first one, come on down. She said we need some theme music or something. Give her a round of applause. This is Goler Blount. She is the, there you go. President and CEO of the Black Women's Health Imperative, the only nonprofit organization created by Black women to help protect and advance the health and wellness of Black women and girls through awareness and education. So Linda, thank you for coming. Next we have Dr. Arlene Richardson. Come on down. She is the chair of the Department of Radiology at Jackson Park Hospital, a community hospital on the south side of Chicago, and one of the recipients of funding from Project Health Equity. Dr. Richardson leads the Chicago site for the RAD-Aid USA Women's Health Initiative in partnership with Project Health Equality. She received her medical degree from the University of Tennessee College of Medicine, followed by radiology residency at Eastern Virginia Medical School, where she was elected chief resident. Dr. Richardson also currently serves in the role of director of RAD-Aid Tanzania, and her goals are to help build and expand global health radiology, imaging, and clinical skills of radiologists at various sites in Tanzania. My goodness, thank you for coming. All right, and next we have our rock star. It's so funny, I call everybody a rock star, but this one, she really is a rock star. This might be the first Mary that I've said that, I'm like, oh, wait. Mary J. Blige is a Grammy Award-winning, an Oscar and Golden Globe nominee, and the spokesperson for BWHI's Power of Sure campaign, aimed at educating Black women on the importance of annual breast cancer screening. Let's give her a round. Come on in. All right, can I take one step in the middle here? All right, shall we dig in? All right, Linda, I'm going to start with you.
Okay.
Why don't you kind of set the stage for us, if you will, and kind of give us an overview of the systemic issues facing women of color, especially in what you see when it comes to their health.
Okay, sure. So a little bit of a background. The Black Women's Health Imperative, as Sheinelle said, is the only national organization that does what we do and has been for 38 years, which in some respects is a little scary to think that after 38 years, there's only been one. But as a part of this work of chronic disease prevention and reproductive health and maternal health and HIV, and of course policy work, we hear a lot from women about kind of what the key issues are and what they're facing. And what I brought since being here is research. So what we see fundamentally are challenges of access. I mean, people know the data around chronic disease and disparities in various disease states. But what we have are problems with access. Employer-based insurance. If you work for an employer that doesn't provide insurance, then you've got to buy it on the exchange. If the best health care isn't located near you, then you've got to get child care, take time off from work, potentially lose wages, just to take care of your well-woman visits. And then, of course, we read a lot in the last year and a half about medical mistrust, which is justified. And, you can ask almost any black woman who will tell you some horror story about how she was treated when she walked into the office, how the front office staff treated her, how the doctor treated her, how, what her experience was like just trying to get care. And of course, what we saw was we're left out of research. So the pulse oximeter last year, turns out, didn't work as well on people with dark skin, dexamethasone. But there are a number of examples where therapeutics aren't as effective because we're not included in research. And the reason we're not included in research is because people don't ask us. So all of this sort of comes together to create these issues that we read about when we talk about data, but that we don't ask about. We don't actually probe to find out why. So we tend to accept, oh, black women just have 42% higher mortality rate from breast cancer, instead of really asking why. It is. It is really 42%, but it doesn't have to be.
Is my mic not working? Is that better? Yes. Black women, say that again, have a 42% higher?
The difference in mortality rate is 42%, but it doesn't have to be.
So on that note, let's talk about some of the barriers. There we go. You talk about some of the barriers that black women face. Quite often, and this goes for probably a lot of us, we don't go to the doctor until we feel like we're hurting, right? Especially as, women, caregivers, they're taking care of everybody else.
Yeah.
What are some of the other barriers when it comes to mammography screening? I think for a lot of people, there are all sorts of preconceived notions. It's going to hurt. I don't have time. Or what are you hearing?
That's exactly what we're hearing.
Oh, yeah.
It's going to hurt. One very common misconception is if I have cancer, when you compress my breast, it's going to cause the cancer to spread. Then there's just the issues of just availability and being able to get access, taking time off from work and that sort of thing. But we've been talking about screening mammography for a long time, 40 years. So to give you sort of that example, in 1982, black women and white women had the same incidence rate, roughly. White women actually had slightly higher incidence rate, but same mortality rate. But in 1983, we learned to detect and treat breast cancer. So this difference that you see at 42% reflects who got access and who didn't. There is no biologic or genetic determinant for any of this. So these issues really have to do with who has access and who is aware. And so one of the things that I was able to do, which was a point of great privilege with Hologic, is actually work on a study to see who was getting access to the superior form of screening mammography, because there are differences. 3D is better than 2D, and we found, of course, not surprising, black and brown women were not getting access at the same rate. So, we've got to make sure that black women know they should get screened, know what kind of screening they should get, and frankly, working with Mary, I was just telling her, women are hearing this message. Finally they're hearing, oh, this is me. I need to get screened. I need to make an appointment. I need to go in. I need to make sure that the women I know and love go and get screened. Because that fear, the ultimate fear, is I've got cancer. Well, if you're going to have cancer, you want to catch it as early as possible. Because if you do, then we can talk about cure, which we normally can't when it comes to cancer.
Dr. Richardson, let me bring you in here. It's interesting because there's this notion, even though we know it's not right, but it's almost like seek and ye shall find. So you almost hope if I just don't deal with it or don't have the mammography or don't have to deal with it, it's almost like it doesn't happen, even though we know that's not the case. You're on the front lines, if you will, on the south side of Chicago. Tell us about your patients and what kind of obstacles they experience in getting regular, preventative screenings and care.
Well, I'm chair of the department at Jackson Park Hospital. It's a safety net hospital on the south side of Chicago, and it's been in that community for 100 years. So we provide medical, surgical, and psychiatric care on an inpatient, outpatient, and emergency basis. A majority of our patients are African American. A majority of those patients are low income. So access is very complex and multifaceted. It's all of those things that we mentioned here today. One of the major things I see in our community is affordability. If you do not have enough money to make ends meet, you're not going to show up and present when you don't have a problem. It's not going to be a priority. Most of our patients present for acute care, and it's kind of difficult to address preventative care at that same time. So affordability is definitely one thing that limits access to care in our community. And I think provider mistrust and misperceptions about the quality of care that they get in our healthcare system keep them from coming into the hospital to get care. And I think the impact that racism has on these disparities is often overlooked because racism is a threat to public health. That's not just my personal opinion. These are statements by the CDC and an American Medical Association. And I think that oftentimes it's overlooked and oftentimes it's misunderstood, the history of race in the medical profession and the part that it plays and continues to play in the access to care and the type of care that we're able to give our patients in these low-income communities. And on top of all those things, now you have COVID. So COVID is also keeping women from coming to the hospital to get preventative care because they're trying to prevent COVID, and I get that, and I understand that. And now we're seeing some delayed diagnoses just because women have put off, coming in and getting their screening. So I want to reassure them that hospitals are safe, one of the safest places you can go, and we've stepped up all of our hypervigilance in keeping you safe. So come in and get your mammograms, and don't let COVID keep you from getting screened.
That's good. You and I were just talking. I'm 43. I just had my first mammogram. It was a little scary. How do you talk to your patients about it, about the importance of screenings? And I know as a radiologist, you also have the task with interpreting mammograms, which can be a little scary. I didn't know I had to express. I had to call home. You know what I mean? Like, it's not something that we talk about.
Right. I combat those questions with education. I just let them know it is very important to get your breast screened every single year. Not just get a mammogram, but get a mammogram every year. If you get a mammogram this year and you don't have cancer, that means this year you don't have cancer. But if it shows up next year and you don't get a mammogram for 2 years, then you delayed that diagnosis. And the most access to treatment and the best treatment is earlier. The earlier detection definitely saves lives. You can cure breast cancer, oftentimes without chemotherapy, if you catch it early enough. And ignoring it is not going to make it go away. And you don't want to wonder, what if I had got my mammogram last year? Maybe I had a chance for earlier survival. Maybe I had a chance to not have to get chemotherapy. So I think that educating the patients, there's cloudiness on what the guidelines are. Should you start at 50, 45, every other year?
What do you think?
Start at 40 every single year. And specifically for Black women, because we are not average risk. I mean, we're dying at a rate 40% higher than white women. We are getting diagnosed at younger ages than white women. We are getting diagnosed at later stage disease and more aggressive forms of disease. So it's imperative that you come and get a mammogram every single year to make sure that you're healthy.
Okay, Mary, I want to bring you in on this conversation because I know you have a personal connection to this topic. But really quickly, you kind of set the stage for what we're going to talk about. You have the numbers, Linda. I know there are different barriers. We've talked about that to screening for Black women than white women. But are they at greater risk? Is that true?
So Black women aren't necessarily at greater risk. We screen at about the same rate as white women. But as Dr. Richardson said, our cancers are detected at a later stage.
Okay.
And part of that is because we develop breast cancer younger.
Really?
Yeah, about 25 to 28% of our breast cancers occur under the age of 50 and 8% occur under the age of 40. So, you heard Dr. Richardson talk about these different times to start screening. Well, if we were to wait to start looking for breast cancer at 50, another 12 to 1,300 Black women would die every year from breast cancer. Why would we do that? But the problem is those studies they don't include Black women. So you can't take studies from Sweden and Canada that the U.S. Preventive Services Task Force does and apply them to Black women. There were no Black women in the studies, and clearly things are different. So we need actually more research on Black women and the way cancer develops in Black women and what that looks like for our lived experience before we apply a policy to them. Because if we were actually to raise the age to 50, then insurance would stop covering it. And most of us under 50 would not pay out of our pocket to get a screening mammogram.
That's true. That's true. So we've talked about the X's and O's of it. And Mary, I know you have a very personal connection. So talk to me about your approach to health and preventative screenings. And there are a lot of topics you can get involved with. Why this one? Why breast cancer?
Well, because, excuse me, I had an aunt that died from breast cancer. And I know this is not breast cancer, but my grandmother died from cervical cancer. And one of my aunts just passed from lung cancer. So it's just cancer, and what happens is they end up in the hospital and it's like, she has what? She has cancer. So there's nobody speaking about it in our families when we're younger. I didn't know about breast cancer or mammograms until I was 40. And I was in the music business, and I was trying to take care of myself. My body started talking, so I started listening. So, you
That's
know,
a good way to put it.
yeah, so you know, you go into the GYN, I found out about a mammogram at the GYN. So, you know, they don't discuss this as children. They don't, you know, tell us, you know, go get a mammogram or, you know, go get a, you know, we learn this as we get older. So they don't speak about it. And that's why they end up in the hospital with 2 weeks to live. And now we know about it because now you have 2 weeks to live and no one is discussing it with us. And that's why it's extremely important to me, because I'm sure it's going on in a lot of African American homes.
No
in
question
our
about it.
culture.
Yeah.
So, you know, it's just scary to not know. I'd rather know, you know,
Yeah.
I'd rather know. And I'm here to let women know that no matter how scary it is or who's telling you it's scary, take care, you know, take care of you. Take
Yeah.
care of your health first, because you don't want to end up as one of those people, because like I said, we don't talk about it. And you don't want to end up like your aunt in the hospital dying from breast cancer, and you got 2 weeks to live, and everybody knows about it, you know, because you have 2 weeks to live. So I'm here because, you know, for us, you know, for us. And, you know, I don't know what it's like in everybody else's culture, but I know in our culture, it's like, that's personal. Oh God, I don't want to tell nobody because I don't want everybody in my business. That's what black women do. So you see me, I'm very candid. I'd rather know, and I'd rather talk about it because I don't want to die.
Absolutely.
You know, from breast cancer or any type of cancer. So yeah. That's why I'm here, because somebody has to say something. Somebody has to help us in our communities get the proper, you know, treatment and, you know, the mammogram, the 3D mammogram, and have it where it's reachable. So I'm reachable. I'm the biggest thing to my culture as far as women are concerned, and they love me. And
It's true.
I have to, and all I've ever done was, you know, speak to women through my experience, not telling them what to do, just from tripping and falling and getting up and going to get a mammogram. And I do it annually now, once I found out what it's about, you know.
I was going to ask you, so I was reading about BWHI. I didn't know anything about it with the work that you're doing. So have you met women who have been open and want to share about it? And also, can you talk about your first mammogram experience? I was just sharing with them, I just did it, and I'm not going to lie, I was afraid. I was a little scared, machinery. But after it was over, I kind of exhaled because I felt like, okay, I did it. But
Right.
what about for you? What was your experience like?
Well, it's beautiful because I have a story that this woman who does my hair just told me just now. She just had her breast removed not too long ago because someone told her that the mammogram was going to hurt, and she never went. And she said when she decided to go, it was one of these type of things. It was talking about it, and she said when she decided to go, she found out she had straight breast cancer. And she had, you know, so this is why, you know, this is why I'm in it. And as far as like my first experience with a mammogram, I'm the type of person, I don't care what type of pain it is, I need to know. So it was like, okay, when I heard about it, it's going to be a little uncomfortable, but once I went, it was nothing. It was like, all right, it's just some pressure, you know, some pressure on your breast, and you're out of there. So,
Yeah.
you know, like I said, I'd rather know. I need to know, you know, than to not know. I got to know, because you don't want to end up dying, you know. That's my whole thing. I don't want to end up dying, you know.
Do you feel like we're getting the word out? I mean, I feel like sometimes we're preaching to the choir. I talk with physicians, or I talk with, you know, these medical groups, and then if you get out on the street and you say, hey, have you had a mammogram? Ooh, girl, no. I don't have time for that. Or, you know, are we doing enough to reach these women?
I think so. I think Hologic is doing an amazing job, and I'm so grateful to be a part of this, because we are making a difference. We are making a dent, because, you know, there was never this much information for us to even go see about ourselves. And my health is my wealth. My health is beauty. My health, you know, beauty is not this to me. Beauty is you healing from the inside out. And so that's, if you're sick, you can't be healthy. You can't glow. You can't shine. You can't be an example to people. Right. So, you know, I'm in the forefront all my life. As Mary J. Blige, the singer, and Mary J. Blige falls on her face. Mary J. Blige gets back up. Mary J. Blige's business is on the ticker. Mary J. Blige, you know, has albums that help women heal from broken hearts. So now I want to help women heal from breast cancer. I want to help see us beautiful all the way around. All, you know, full. You understand what I'm saying?
Absolutely. I am so happy that we are talking about beauty from the inside out, because for so long, you flip through the magazines and it's makeup, which is, don't get me wrong, I'm like, love makeup, hair and clothes, no, but seriously, jewelry. But now I think women are starting to realize, oh, your skin is so pretty. No, it's not a cream, it's because I actually eat right and I go to bed. Do you know what I mean? So I think, I think when you know better, you do better, to quote Maya Angelou.
Yeah.
And I really do think that's what's happening. Everybody keeps mentioning the 3D mammography. When you walk into an office, is that something you're supposed to ask for? Like, I'm ashamed that if you ask me right now, I don't even know if that's what I had.
And really, you shouldn't have to know.
Okay.
Your provider, your OB, your internist should say to you, as a black woman, I recommend that you get 3D mammography and refer you to a facility. Now, Dr. Richardson will talk about why it's better.
Will it cost us more? Because that's the first thing I would say, which means other people would ask the same thing. It's true.
Usually it doesn't.
Because most insurances cover it. And the ACA covers it.
So is that something you would tell your patients to go ahead and ask for, or for people listening? Or
Absolutely, we'll recommend a 3D mammogram for anyone getting a mammogram if they have access to one.
Okay.
Yes,
Okay.
it's definitely superior.
I was just looking at this. A study reported breast cancer screening access, utilization, and outcomes by race for nearly 400,000 Asian, Black, and white women who underwent more than 800,000 mammograms at breast imaging facilities in the U.S. And it revealed that Black women are receiving inferior breast cancer screening.
Right.
What does that what do you mean?
Because black women are typically not being referred to 3D mammography.
So the screening itself is just
Right.
not as accurate?
Yeah, first of all, they get referred less. I mean, screening rates are about the same.
Okay.
But some of that is just women taking it upon themselves. But when it comes to the specific type of screening mammography, they're less likely to be referred to 3D mammography, which is superior, which has been proven superior. And the crazy thing is, some doctors don't know. I mean, they're not keeping up with the literature, I get, but your OB should know.
Okay.
But the crazy thing is, if a black woman and a white woman have the same breast cancer, same diagnosis, same treatment, they will have the same outcomes.
Okay.
There's nothing about black women that causes them to do worse. The issue is that's not happening. So we're not getting referred, we're not getting our cancers diagnosed early enough, and so by the time they're diagnosed, then treatment is much more burdensome and the outcomes just aren't as good.
So you just have to speak up when you go in, essentially?
Exactly.
Talk to me about, I've learned a lot about Hologic and Rad Aid, this partnership. What are your hopes for the partnership, and tell us about it?
I think that would be a better
Linda.
question for
Okay,
Linda.
no,
Yes.
no problem. Because Dr. Richardson is also a partner in this, but this is a study. When we actually, you referenced a study that looked at the fact that black women and Latinas were not getting access to 3D mammography. So we're in the midst of a study to actually bring 3D mammography to the women who need it the most. So Dr. Richardson is part of this. This is happening in a number of cities to make sure that, one, women know this is superior, they should get it, and two, they actually are getting it. But the innovative part of this whole study, and as far as I know, and I try to read the literature, this has never been done. It's exploring from the very first point of entry what that black woman or Latina's experience is. So from the time that she walks in the door and somebody says, "Hey, Arlene," instead of "Hey, Dr. Richardson," all the way through her last visit. So screening mammography is being brought to women. If there's an abnormal finding, it's followed up. If there's a cancer diagnosis, women get treatment. This is huge because nobody should die from breast cancer. But this is a partnership of Rad Aid, who's doing the radiology, and Hologic, and the Black Women's Health Imperative, who's trying to get the word out, in partnership with Mary to say to women, go, get screened, and particularly for low-income women, get screened. If you have breast cancer, it will be treated, and you don't have to worry about the cost. But it's better, and I'm going to quote Mary all the time, it's better to know, and just get it done.
This is groundbreaking. I think it's phenomenal.
It is.
So then do you follow up, or are we not there yet?
Well, of course it will be followed up.
Yeah.
Yeah. I mean, it would be unethical not to do
Sure.
that. And that's part of what makes this so innovative and so unique. And it just, as a partnership, this never happens. And people talk about, private, nonprofit partnerships all the time. This is one that works.
You brought up something, when I said follow up, it's because you mentioned it takes all of this work, right, to get the woman in there to get her mammography, and then now she's done it. She's like, check. She's not thinking about the next year and the year after and the year after. That's what I meant. I feel like we've got to be all in with this, continually, don't we?
I agree, and I think also the provider should tell the patients and give them the information that it is important to come back every year, and we are responsible for reminding patients as well. So I think it has to work on both ends. So, for example, you talked about access to lower quality mammograms. A 2D mammogram is a great mammogram. I'm not saying if you only have access to a 2D mammogram not to get it. It is the reason that the mortality rate is dropping. I think there is a widening of the gap because a lot of Black women in those neighborhoods do not have access to 3D mammography, which does detect more breast cancers and decrease false positives. And so through projects like Project Health Equality, my hospital was able to get 3D mammography. So now we're able to provide superior breast screening to all of our patients. And that is one of the reasons why these type of collaborative projects is good. It's a more well-rounded project, and it is a sustainable plan. It's not to just give a machine and then tell the hospital how to figure it out. We have low resources, which means that we're not able to do things on the cutting edge. We're just barely getting by. And so these types of initiatives are very much needed to kind of help close that gap that the burdens that the hospital has so that we can provide better care to our patients. So I think it is very much needed. Yeah.
You're with these women day in and day out, and I started this panel by saying, it's one thing to talk about screening and mammography and 3D and these larger topics, but these women, you see their faces, you see their children, you see their families. Have you seen the difference that it makes?
I do, and I think that just treating them like their lives matter makes a difference. There's a lot of provider mistrust. When I meet patients, I can't tell you how many of them are happy to see someone like me, someone that they think that they can trust because I'm a reflection of them. I care, and I think that definitely makes a difference in how a patient feels the quality of their health care is. I read the mammograms, not the patient, so they might not know what quality the image is, but they know how they felt. They know whether that system made them feel like they are important, and that's what my job is as a radiologist.
I keep reading about this nurse navigator. What does that mean?
It's just like it sounds. It's a nurse that navigates the patients. It's a really integral part of the project, actually, because the healthcare system can be very fragmented if you've ever tried to go from one appointment to figure out how to get to the next. And that delay in time trying to figure that out delays the care between screening, diagnosis, treatment. And so the navigator, just like if you put anything else in a GPS, this person at the hospital will help the patient get from point A to point B. If they have an abnormal mammogram, they'll talk to them about it and help them get to the diagnosis. If they have a diagnosis, they'll help them get to the treatment that they need, oncology, surgical, give them information to help them and their families, because their families are going to go through this too. So the nurse navigator position is very much integral in helping patients through the system to make more efficient care, better follow-up of care, and make the patients feel like they're getting everything that they can get out of this healthcare system.
It feels good to hear that we're taking care of the whole woman. I'm sitting here thinking, when it comes to education, right? I'm going to give you a random analogy. I was sitting here thinking, I remember when we started doing stories in Harlem where you take these kids who are in pre-K or kindergarten, right? And you pour into them, you check up with them, and you follow them all the way through. And by the time they're in high school, we have guided them all the way through, and then we can send them off to college, right? And so we know that when you nurture the whole child and you have someone to follow up year after year after year, you have a better outcome. So I almost feel like we take care of our kids, and now it's time to take care of the caregivers. This is my random thought in this moment, so forgive me if it sounds crazy. But I do think it's almost like taking care of the woman, right? Sure. Have you had your appointment? Okay, you're going to get this confusing result. This person is going to call you. It almost sounds like this is what has to happen.
And it makes perfect sense.
Yeah.
I mean, the thing about navigators is, yes, they help sort of in that moment, but they help so much more, as Dr. Richardson said. And the evidence, the literature is clear. Navigators help save lives, because they will take the time and explain, here's what's actually happening. Doctors are busy, I get it. Nurses are busy. Bedside manner, not always the greatest. But navigators will say, let me just tell you what she said and what that meant.
And that's what you need.
And that's what you need.
Oh, yeah.
And you need it from somebody you feel like you can trust, who actually has of course, providers have your best interest at heart, but this person's going to get to know you. Most times, your provider doesn't really get to know you. And this navigator is going to get to know your life and your family and be able to guide you in a number of areas so that you are making the best decision. Because we talk about that provider-patient partnership all the time, but it doesn't really happen all that well. But this is truly a partnership where the woman will participate in her screening and her care if she needs it. and the next year, and the next year, and the next year. This will become a way of life for her.
I love that.
Yeah.
Caretakers need caretakers too. Do you know what I
Absolutely.
mean? And that's what this feels like. So let me give you guys each, as we close out here, a final thought, if you will. Mary, I'll start with you. The message you'd like to share with other women. We're also screening this, so I think there are women who we don't see who will receive this about the importance of breast cancer screenings, or what you'd like to leave them with today.
I'd like to leave them with this. Beauty is just not vanity. Beauty is your health. Your health care is beauty. That's the only way you can be beauty. So your health is beauty. Beauty is your health. Your health is your wealth. And I say that because without your health, you can't make money. You can't take your kids to school, or you can't move around without your health. So you can't make money without your health. So your health is your wealth.
Amen. And thank you for all you're doing, because you're right. We do listen to you, and women do listen to you.
Thank you.
Yeah.
All right. And what would you like to say? What do we want to leave everyone with?
So, I want to leave people with these disparities that we see, that we talk about every day as though they're just a way of life, don't have to be. There's absolutely no reason for there to be a 42% difference in mortality rate in breast cancer between black women and white women. And, listen to Mary. I mean, you have got to get screened. Black women in particular endure a whole lot of stuff. A literally few seconds of having your breast compressed to know that you don't have breast cancer, I think are worth it. And ask for a 3D mammogram if there's one in your area. Go to besure.bwhi.org and get more information.
And just to follow up really quickly, for the faces in this room, they're nodding, they're affirming. What would you like us to do? How can we help?
Talk about it. Part of this challenge, as Mary mentioned, is like, we just don't talk about this, and people are uncomfortable talking about breast cancer in particular. Talk about it. If you know someone, if you've got a friend, a colleague, a relative, all you have to do is just ask, hey, have you gotten your mammogram this year? If she's over 40. Or for her, on her 40th birthday, send her a birthday card. Say, hey, you know what you get to do this year? You get to get a mammogram.
That's true.
And accompany her if she wants.
It's true. I just thought about something. So
Please.
your silence is deadly when it comes to this. Do not be quiet about it. Speak to your children about it, because we didn't know about it at all until I was 40.
Yeah.
And people were dying, So
That's good.
Yeah.
That's really good. Okay, no pressure.
So my answer is very simple. If you're a woman and you're 40 years of age, get a mammogram, get it every year. That's it.
And then what about for the people here? How can we, like I said, quite often we're preaching to the choir. What can we do to make your life easier in what you do and to help your patients? Seriously, what can we
Really,
do?
I think talk to the women that you love about it, and talk to them early, your daughters, your aunts, your sisters, your friends. Just spread the word and let them know that 1 in 8 women will get breast cancer, and it could be you. And what you want to do is catch it as early as possible, because early detection saves lives.
Amen. Can we give them a round of applause? So good. So good. Where did Jen, oh, there you are. I didn't know if you wanted to say anything. We want to thank Jen, the entire Hologic team for hosting us here at NASDAQ. My first time in the building, quite frankly.
Yeah, me too.
We see
Mine
the
too.
scrolls all over the place, but I'm like, ooh, we're inside the building. For such an important topic. And thank you for your time. And also, Mary J. has a special gift for all of you. I've had this wine. It's quite delightful. Thank you. Thank you. And a donation. Thank you. I do want to throw that in there, a donation made by Hologic on your behalf to BWHI. So this has
Thank
been
you.
such a pleasure. Do you want to have anything you want to add to that?
Just thank you so much for all of your support and partnership over the last year, and I know many years to come. I think these conversations are what make a difference, and I love what you said, silence is deafening.
Yeah, it's good. You're saving lives collectively. Thank you, guys. God bless. Thank you.
Thank you.
All right.
You getting it?